Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
It's an intimate examination many women refer to as the dreaded pap smear, myself included, and it's one that must not be missed. But did you know that when it comes to ensuring that your reproductive system is healthy, the pap smear is not enough?
We all know about the pap smear. Pap smear is very important in picking up precancerous changes in the cervix, but that's just one of the below-the-belt cancers. We still have 4 others. We have vulval cancer, vaginal cancer, uterine cancer, and ovarian cancer. So a woman tends to believe once they've had their pap smear that all is well, if that is normal.
Meet Dr. Vikash Chatrani, obstetrician, gynecologist, and gyne-oncologist. He's seeking to bring awareness to gynecological cancers, or what's now more commonly known as below-the-belt women's cancers.
And they account, as Patricia said, 19% of the 5.1 million estimated new cancer cases, and results in 2.9 million cancer deaths worldwide. So these cancers have a high mortality. And I have this slide in presentations over and over again because it's an important slide. Cancer is on the rise. It's the #1 leading cause of death from non-communicable diseases. Some people may ask why. People are living longer, they're exposed to more carcinogens, which are cancer-causing agents. And once you live longer, your chance of getting cancer in life increases.
Talk of below-the-belt cancers has taken the limelight within the last few years, according to Dr. Chatrani, because the focus had mainly been on breast cancer. He explains that statistics show more women are now dying because of gynecological cancer.
If you look at the mortality rate for breast cancer, less than 25% of women will die as a result of the disease. And that's because the Cancer Society and their cancer awareness programs have been doing great jobs in advocating screening with mammograms. So we're picking up breast cancer early. We're treating it, we're curing it. But if you look below that breast cancer line, and you look at the 5 below the belt cancers, I actually have 3 depicted there. You will see that cervical, uterine, and ovarian cancer, if you add the mortality, which is the red lines, more women are dying because of below the belt women's cancer. And that's mortalities in excess of 50% for cervical, in excess of 60% for ovarian. And just when you add them up together, it's more than breast cancer.
He could not stress enough the focus that is needed below the belt, and to get his message across, he went on to explain.
Any bleeding after the menopause is a signal that you must get checked to make sure you don't have uterine cancer. Majority of the cases, it may not be cancerous if you have bleeding, but unless you visit your doctor, you're not going to know. Ovarian cancer, another major cause of significant morbidity in women. The symptoms and signs are very vague. So if you experience abdominal bloating, abdominal pain or discomfort, a pelvic pressure or fullness down below, it may be a sign of ovarian cancer. Now, I saw a lot of eyebrows go up just now when I said some of those symptoms. You may eat bad food and get a little bloating, a little discomfort. So these signs and symptoms must persist for more than 2 weeks. Don't ignore them. In other words, pay attention to your body. If there is something that has changed, and it's changed and persisted for more than 2 weeks, there must be something going on. So visit your doctor. With vulval and vaginal cancer, once you get your pap smear, your doctor will examine that area too as well when they're inserting the speculum to look at the cervix, so they can see lesions there.
Ladies, it's time we make the privates a public discussion. Let's keep our reproductive system healthy. Get your check below the belt today.
I think the key is visit your doctor. 1, know your body. 2, and I think the most important thing when you leave here today is to live a healthy lifestyle. So whether it means doing exercise 3 times a week or eating responsibly, it's important.